Hello, everyone. I am Dr. Sri Banerjee, core faculty for College of Health Sciences at Walden University. And it is with great honor that I present potential health effects of loneliness in the pandemic era at the European Union Public Health Association. First of all, I would like to start off today by talking about the uh, effect that the pandemic has had collectively on the global population. In one way or another, COVID-19 has affected all of us, whether it's directly. Some of us were unlucky to actually have contracted the infection, and then others indirectly may have felt it through loneliness or social isolation. So, in this research study, I teamed up with um, the School of Counseling and other individuals that have worked in psychology in order to understand more specifically the exact effects of loneliness and social isolation. Now, it had already been identified by the former Prime Minister of the United Kingdom, Theresa May, that loneliness is in itself considered to be growing in epidemic proportions, and it is in fact an epidemic. And so, if we think about the health effects and the health consequences combined between the pandemic and loneliness, the hypothesis was that there would actually be increased poor health outcomes. So, before we started anything, though, we wanted to look further into understanding how this topic was being searched within the internet. And so, um, looking at Google and some of the search trends, this was a analytic tool that was used actually to monitor flu earlier in the last decade. But that same technique we use to understand the search frequency of loneliness in relative terms. So now we had to be careful here because there were certain current events that were taking place. For instance, at one point, Britney Spears re-released a song with the term loneliness emphasized. So a lot of people were actually searching for this term, but we had to actually take into consideration these types of events. After this, we actually developed a comprehensive sort of model, and this model is reflected under results. And that is the SDCM, the Social Distancing Conceptual Model. And this model, we took a lot of time to try and understand the major components of this. But if you take a look at the highlighted area, and take a look at what is emphasized. So in terms of social inequity is something that is really emphasized in order to create cohesion. And so the in order to understand the parameters of inequity, um, it's important to go through that loop. Now, the other side of that is social justice. And so we provide a lot of these ideas within this cohesive framework to understand better how loneliness impacts society and, more importantly, how this impacts overall health. Now, the third part of this was to understand the overall impact of social isolation, loneliness on overall health. And so, even though we did not have enough data, enough current data to conduct our analysis, we were able to look at data um, in National Health and Nutrition Examination Survey, looking between 1999 and 2008, and then looking at follow-up data through 2015, we were able to see how social isolation and loneliness affects overall mortality. Now, what we were not able to understand and directly see is how this combines with the effects of the pandemic. But from running the analysis and looking at some of the hazard ratio that was yielded from the Cox regression analysis, it was pretty clear quickly that social isolation was causing increased mortality. So there was actually, according to our findings, after controlling for confounding variables, a 20% higher increased likelihood of mortality. So this is important because when you're thinking about social distancing and social isolation being the panacea to try and combat um, the pandemic, and we're still reeling from it. Um, it's important to note that loneliness and isolation, in and of itself, are causing and contributing to poor health outcomes. So, on one hand, you're mitigating one type of disease, but then on the other hand, the risk factors of other diseases may inadvertently increase. So, it's important to keep in mind when we're creating policy in order to address pandemics or just overall health, the aspect of social isolation and loneliness. Thank you for listening.